Thank you, Molly, Tracy, Molly. I did sneak away from you guys over there to meet up here with Aaron, and Aaron's one of our new additions this year, so welcome.
Hi, David.
It's really fun to talk with you, and one of the things that you really help us with is we're a firm believer of time, talent, and treasure. And all those are what helps an organization grow, and one of the most important pieces is all those folks that volunteer with us. And so maybe we should start with the volunteers, because without folks volunteering, we just can't do all the things that we do. So that's the most important piece, is the volunteering and time.
Well, thank you, David, and thank you for that kind introduction. Molly's Fund is defined by the literally hundreds of people who volunteer for us every year. And we have a lot of opportunities to get involved, whether you want to serve water at one of the races that we're the benefit of, if you want to help set up our gala and auction in October, that's another option as well. And heck, if you even want to do office work, we have tons of needs in that area, so there is literally a job for everyone here at Molly's Fund if you want to volunteer.
And I know you like it when people come and help in the office.
Absolutely. Well, it makes my life a
all
lot
our
easier.
jobs,
Absolutely.
because the other day we had to stuff hundreds of flyers.
Oh, that's right. That's right.
So
there's a lot that goes into this stuff behind the scenes that most people don't
exactly.
see. So another exciting program that I definitely want to mention to you is our Dine and Donate program with Baja Fresh.
Brand new?
That's brand new this year, and we are so grateful to Baja Fresh for providing us this opportunity to be in 12 locations in the Portland metro area. If you go online to our website at mollysfund.org, you can see all of the locations. And this year, we're offering each customer who comes into Baja Fresh to donate $1 or $5 with their purchase. And it's just a great program. It's going to be great for lupus awareness, and it's going to run all the way through the month of May.
And the other part that's really exciting about it, for those that are watching us from all over the different parts of the country, we can create a program in your own city. So it's not just here in Portland.
Yeah, that's right. I mean, we offer opportunities for people around the country to fundraise for Molly's Fund. We've got a great program that we're running right now called the Fundraiser, and it's just fantastic. I mean, we will provide you with everything you need to fundraise for Molly's Fund. We'll send you brochures, we'll make posters for you, we'll even create your own event page that will live on our website.
So if I wanted to do a lemonade stand, and I did a mean lemonade stand when I was a kid.
Oh, lemonade stands, car washes, there is no event
I'm not doing
too
the car
small.
wash.
Yeah.
Okay, okay. But lemonade stand I could do.
Yeah, absolutely.
So now you did talk about walks and things, and
That's right.
people are always asking, well, but I don't live in Portland. But we have virtual walkers.
That's right. Every event that Molly's Fund does, we provide the opportunity to be a virtual runner or walker. And this will allow you to go on, create your own profile on a fundraising page, and raise money from Molly's Fund from wherever you may be. And this year we're even offering excellent prizes. We are offering...
and this we're really like this one.
This is really exciting. We're offering our Lupus Suck shirts to every person who participates and raises a certain amount of money for each event. And I just think it's a really cool way for people to get involved wherever they may be in the country.
And so much fun. Well, Aaron, thank you for coming on board this year. You have been a great addition. All the things that you've done for us and working with our partners in cities all around the country is very, very exciting. But now we need to go back to Molly, who's sitting over on the couch, who has got some exciting things to show us. We've been working really hard on it. We got 2 new radio ads and a TV spot.
Thank you, David.
Thank you, Dave and Aaron. I'd like to encourage everyone to get involved, volunteer, or come to one of our events. I guarantee you'll have a great time. And now it's my pleasure to introduce our new radio and TV campaign. Let's hear our radio campaign right now.
My name is Molly, and I have lupus. Each year, thousands are diagnosed with lupus, a painful disease that has no cure. Lupus is more common than muscular dystrophy, multiple sclerosis, leukemia, and cystic fibrosis combined. It's time we brought lupus out of the shadows and into the light. May is Lupus Awareness Month. If you or someone you know has lupus, come join our online community at mollysfund.org. That's mollysfund.org. Please join us. You are not alone.
And now I'd like to unveil our new TV spot, which you can share with family and friends. This spot features lupus patients who are bringing it out of the shadows and into the light.
My name is Anita, and I have lupus.
My name is Chris, and I have lupus.
My name is Molly, and I have lupus. Each year, thousands are diagnosed with lupus, a painful autoimmune disease that has no cure. Did you know that lupus affects 1 in 185 people worldwide? It's time we brought lupus out of the shadows and into the light. If you or someone you know has lupus, let them know they are not alone. Please join us at mollysfund.org.
Thank you to all the lupus patients who participated in making this beautiful and meaningful TV spot. And now we're going to cut to Dave, who has a very special guest.
Thanks, Molly. You're absolutely right. We do have a very special guest. We have Speaker Kotek from the Oregon House of Representatives here to talk with us today. And, you know, the first starting point happened a couple years ago that you helped us with, and that was our very first proclamation.
Yes, in 2011, we passed a bill that would say that May, going forward, is now Lupus Awareness Month.
Thank you.
It was, you're welcome. We do those proclamations for complicated issues because part of our job as policymakers is to raise awareness on issues like this.
Wow, excellent. Thank you so much. Now, how does the average citizen interact with someone like yourself to help bring awareness to, and advocate for themselves?
Well, what's really important for people like me, because we don't know everything that's going on there, is personal stories.
All right.
You know, I have families and family members and friends who are impacted by lupus, and so I know a little bit. But when a constituent comes to me and says, I have lupus, or I think I have lupus, this is how it impacts me, this is how it impacts my health care, those stories help us do the kind of work we need to do on behalf of Oregonians. So what I always recommend to people is get to know your legislators. Come have a cup of coffee with me or the other person who, whoever represents you. Tell them your story. Come down to Salem. Come tell stories to committee members because, you know, while we can raise awareness, we might have to look at healthcare and how that's impacting people with chronic conditions, and we need that input to do a good job.
Wow. And you're not even very scary. I mean, you feel very comfortable.
We're real people.
Yeah, no,
we're
I really
very
love
nice
it. I mean, it's really
people,
nice.
And Oregon, you know, we have very accessible legislature. It's a citizen legislature, but we bring our expertise to the job. The more I know about what matters to people, the better job I can do. So you have to advocate not only for your health care, but for the public policy that helps you.
Wow, that's excellent. And you made me feel comfortable. So all of you, I would encourage you to step out of your comfort zone and reach out to your representative and help make a difference. Thank you for coming.
Thank you for having me.
You know, and I think we need to go back to Molly, and I see that she also has a guest, and I see BG is sitting over there and ready to do some talking about 1 in 4 Coalition.
Thank you, Dave and Speaker Kotek. It was great information. Sorry, just patient out there. I have a cold and am losing my voice. With me today is BJ Kavnor, who is the Executive Director of 1 in 4 Chronic Healthcare Coalition. He's going to answer some of our questions about the Affordable Care Act and the new healthcare laws. Welcome, BJ.
Hi, Molly. Great to be here. I hope you're feeling better. And this is our 1-year anniversary as being a program of Molly's Fund. So it's fantastic to be back and to share this with you.
I'm really glad to have you here.
Thank you.
So what exactly is 1 in 4 Chronic Health?
1 in 4 is a chronic healthcare coalition, and we provide services for people living with chronic healthcare issues, including lupus. The Centers for Disease Control defines a chronic illness as anything that lasts 3 months or more.
Okay. So do you think the Affordable Care Act has helped or hurt patients with lupus?
Definitely helped. Definitely helped. We have more people who have coverage of insurance now through the Affordable Care Act. We have the elimination of pre-existing conditions. We have the elimination of lifetime caps and annual medical exams for everybody, which means that we hope we'll be able to screen people for chronic health conditions and diseases like lupus earlier, and so get that 4.5 annual year time frame down so we can get people into treatment.
That's so wonderful. Can you tell me a little bit about what's the difference between the exchange, Medicare, and Medicaid?
Sure. The exchange is the Travelocity, as it's called, of where everybody can go to and choose their healthcare plans. States can either make their own exchange, or 26 states decided to go with the federal exchange. And this is what Oregon is doing as well, because a little bit of difficulty rolling out Cover Oregon. So
Yes.
Oregon decided to go with the federal exchange. And so you can shop there as an individual, as a small business owner, for options. So your insurance is portable now. So if you want to leave your job and go and start your own bakery, you can do that, and you can you could find affordable healthcare coverage for yourself and for your family. Medicaid is our safety net in this country. Medicaid was expanded to 65 million people, including 30 million children, through Medicaid expansion. I know this is absolutely incredible. And this is people who can earn up to $16,500 a year on average, and they're going to get some assistance in paying for Medicaid or paying for private insurance when they go above that. So this is a fantastic expansion for being able to provide health care to our poor, before they become very, very sick. And Medicare is the program that we have that provides services for the elderly and for people who are disabled. Medicare has a number of parts, and it also has a drug program called Medicare Part D.
Okay. Thank you so much for being here, BJ. That information was very important and very valuable. We appreciate you coming out.
Oh, thank you. It's a pleasure to be here. And, you know, it's great to be able to work with Molly's Fund, and just all of us are working to make sure that we're able to provide access to treatment and to medication for people living with chronic conditions, and including lupus.
Absolutely. Thank you so much. Let's welcome back Dave to the set.
Thanks, BJ. And don't tell Aaron that T-shirt. Look what I got you.
This is great.
Just for you, man.
This is
Thanks
great.
for coming out
This
this
is going to
morning.
be fun to wear at the gym.
All right, cool. Thank you,
Thanks,
sir.
Dave. Molly, take care.
You too.
Hi, Molly.
Hi, Dave.
Isn't it exciting? We had Speaker Kotek. I got to talk to Aaron. We got to talk with BJ a little bit. It is amazing what has happened since last year.
We've had an amazing year.
And we have another fun part going on. And, you know, from the West Coast to the East Coast, we have Ken from the Alliance for Lupus Research. And we haven't even talked about that piece of it, but that's such a huge piece of now taking lupus out of the shadows is finding a cure.
Yeah.
And Ken and the Alliance for Lupus Research is really helping us with that. So let's go to Ken in New York.
Okay.